Terrific. Good afternoon, everyone. I'm Healey, Massachusetts Attorney General. Thank you for joining us here today. With me today, an opioid epidemic that is running rampant across our state. I want to thank, in particular, Chairman of the Judiciary Committee, John Fernandez, is here with us. Representative Paul Tucker from Salem is with us. Middlesex District Attorney Marion Ryan is with us. Northwestern District Attorney David Sullivan is with us. State Police Colonel Rick McEwen is with us. Chief William Brooks from the Massachusetts Police Chiefs Association. Chief Brian Kais from the Massachusetts Major City Chiefs Association. And Joanne Peterson from the group Learn to Cope is with us. Also with us today, Representative Day from Winchester is with us. Thank you very much, Representative, for being here. I also want to especially thank someone who is with us here today, Kathy Fentanyl. Kathy has joined us here today from Quincy to share her story about her son, Paul, and her family's story. I can't thank her enough for being willing to come here today to talk about what this is all about as a way to help other families across our state. Thank you all for joining me here today. In Massachusetts, last year alone, heroin and opioid claimed over 1,200 lives. That's an average of 4 lives a day. That doesn't begin to count the countless number of overdoses across our state in communities large and small, rural, urban, and suburban, rich and poor. These were people's mothers, fathers, brothers, sisters, husbands and wives. These were and are people's children. All of us are here working hard to combat this public health crisis on a number of fronts. We're focusing on providing outreach and education, efforts to achieve better intervention, better access to treatment. We're going after those who are prescribing and dispensing drugs in medically inappropriate or criminal ways, and we're working to shut down pill mills in this state. We're also collectively working on taking on drug traffickers and drug trafficking in this state. Those individuals and entities who would put drugs in the hands of those struggling with addiction. Today in Massachusetts, we can and do prosecute people for trafficking heroin. But today we're here to talk about another drug, a drug called fentanyl, that is up to 50 times more potent, more dangerous than heroin. And we don't have the power to go after those who traffic it. Fentanyl is a synthetic opioid created to provide powerful pain relief. But now the drug cartels have figured out a way to manufacture fentanyl, and they're sending it out into our streets. I want to show you something. This is a glove here, and what we see in our cases is we see efforts to create and manufacture fentanyl. They will manufacture it and oftentimes tie it up in a glove finger size amount. It's approximately 10 grams. And this is how fentanyl is increasingly trafficked in and around our state and into our state. More and more police officers and law enforcement are finding heroin laced with fentanyl, and sometimes fentanyl is showing up alone. Just recently, state police in our office, working with local police, arrested individuals allegedly involved in an extensive fentanyl and heroin packaging and distribution operation involving over $1 million worth of drugs, including over 1 kilogram of fentanyl. The reality is that many heroin users don't even know that the drugs that they're using contain fentanyl. It looks just like heroin. It's killing people, it's hurting people, and we need to do all we can to get fentanyl off of our streets. That's why we're here today to announce that we are filing legislation that will make trafficking of fentanyl a crime. Under this proposal, those convicted of fentanyl trafficking could face up to 20 years in state prison. By criminalizing trafficking of fentanyl, we will give police and law enforcement the tools they need to get this deadly drug off of our streets and out of the hands of those struggling with addiction. I'd like to thank in particular Chairman John Fernandez for his leadership and for sponsoring this legislation. This is important legislation that I truly believe will make a difference here in our state. I also want to thank the 56 other legislators who have signed onto this legislation, particularly Representative Tucker, who knows from his days as a police chief how important this issue is. I also like to thank my many partners in law enforcement who are supporting this bill, including the Massachusetts State Police, the Massachusetts Chiefs of Police, the Massachusetts Major City Chiefs, and so many of my district attorney colleagues, particularly DA Ryan and DA Sullivan, who I'm proud to have at my side here today. Thank you to everyone who's worked on this important piece of legislation. I sure look forward to its passage, and we'll work hard to make sure, I know we will collectively work hard to make sure that this bill gets passed. It is important. I know it will make a difference. And again, I want to thank all of you for joining me here today in your continued efforts to fight this terrible scourge that is ravaging communities and families across this state. But I know that in working with this legislation and continuing to work across the numerous fronts that all of us are working on right now, on intervention and outreach and treatment and education, we will get to a much better place for the health and well-being of our families and for our communities. So thank you, and at this point, I would like to turn the podium over to Chairman Fernandez.
Thank you. Thank you, General. I can only really echo the words of the Attorney General here today. We in the legislature have been publicly focused on efforts to deal with the crisis of addiction that is inflicting so many families within our communities. And we've worked on programs to increase treatment, to make those opportunities available to families and young people in particular. We've worked on diversion programs to try and move people who find themselves arrested but need diversion to treatment to get them out of the criminal justice system, and public awareness of the risk that the Attorney General has spoken about regarding the heroin and fentanyl mix. But it's important that we make sure the public understands that we are committed also to disrupting the trafficking and the distribution system that gets that heroin and gets that fentanyl into the hands of people who do not know what they are taking. So when the Attorney General and I began talking about this issue and she talked about legislation, it's consistent with where I believe we need to go, which is to make sure we make that distinction between those who need our help and those who treat this as a business without regard for the deaths that are the consequences. So I want to thank the law enforcement people who are here and who are on the front lines of this, be they the local police, the state police, the district attorneys. Those people are doing the work and they need the tools. This was a gap, is a gap in our system, and it's one I hope we in the legislature can close quickly. And I appreciate the support, the bipartisan support of the 57 legislators, particularly Representative Tucker, who is here today, Representative Day. But Representative Tucker and Representative Whalen have been out on this issue with their law enforcement background talking about it as well. And we need this kind of leadership, and my hope is that we can move this legislation quickly. Thank you.
Thank you. I'm very honored to be here. I want to put a face to this epidemic. I have proof in my son's death certificate that he died from fentanyl. Yes, he was a heroin user, but that's not what killed him. What killed him was a laced opiate. The good thing is that I do get to be here and let everyone know that this is my son. This is Paul. I lost my son 6 months ago. He started off at the age of 13 with, like most of them, marijuana. Then it turned into alcohol. Then it turned into prescription pills. Then it got as far as he was having Oxy-80s. Then, obviously, Oxy-80s are expensive. You have to downgrade, and that's how we got into heroin. I watched my son Paul suffer for 8 long years. I stand here before you, a strong woman, because of the horrific things I saw my son have to go through and suffer with this addiction. It is not something that somebody chooses, okay? Yes, an addict has to choose it at first, but after the first time, it literally takes a hold of you and turns you into a complete person that you would never expect yourself to be. There's a new face of addiction. It doesn't look like what you would assume, a homeless person on the streets, no teeth, you know, just a bum. It's not what it is. It's our kids. It's me, it's you, it's a judge, it's everybody. There's a new face. It just doesn't junkie. Hate the word, hate it. But something needs to be done. Someone needs to be held accountable. It's an instant death, and they don't even know. They're just trying to get the next fix to numb the pain. These people hurt. My son hurt. He doesn't choose to be homeless. He didn't choose to not have a job. He didn't choose to have to do the horrific things that he had to do to support his habit. And that's why, again, I stand here before you very strong and out there, because we're losing a generation. I have 2 other children, the ages of 12 and 11. And if I don't say something or make it known, I'm not really making a difference. And I have to, because this is our kids, this is mothers, fathers. So I'm very blessed that you're making this someone held accountable for all these lives gone. And again, it is 4 lives a day. It's horrible, but I thank you for listening, and I hope we can have some change. Appreciate it. Thank you. Thanks, appreciate it.
Good afternoon. I'm pleased to be here today with our Attorney General, with Chairman Fernandez, and with my law enforcement and legislative colleagues. You just heard about the human face of this epidemic and why we need this legislation. But there is, as there always is, the reality and the practical piece of why this is so necessary right now. This morning I was at our Southeastern Middlesex Opiate Task Force, where we talked about the numbers, and we heard a doctor speak to us about how quickly the level of addiction increases, given the strength of the heroin that's on the street. And one of the reasons that there is that strength of heroin is fentanyl. But what's more interesting, which more points out why we need this legislation right now, is to look a little bit at the history of fentanyl. For many, many years, we saw fentanyl only as an additive. We would find heroin, and it would have been laced at some point in its transit with fentanyl. In the last couple of years, we've begun to see an enormous amount of fentanyl as a standalone drug. And I would suggest to you, why is that? There are 2 reasons. One is because it's valuable. It is very valuable. You saw the general show you how much can be packed into this glove. So imagine this glove with all the fingers filled, still not very big. And think about the dollar value. And the second, and perhaps more compelling, is what we're addressing today. It is that until we pass this legislation, there is no criminal penalty for having an excess of 10 grams, remember that's 1 finger, of fentanyl in your possession. So you are able to profit from this misery, and you do not run the same risk of prosecution that you do with other drugs. That's why this legislation is so important, because it closes that gap. It shuts down someone's ability to make money off of this scourge without fear of punishment. So we will certainly be supporting the efforts and joining with our legislators and law enforcement partners in attempting to get this bill passed as quickly as possible. Thank you.
Thank you, Attorney General Healey, for inviting me here today to discuss the fentanyl problem. I also would like to thank Kathy, whose words come from a painful place, known by all too many parents and the representatives from support and recovery organizations who, like police, work with this issue every day. I concur with Attorney General Healey, district attorneys, and lawmakers who are here today, and that fentanyl, without a doubt, is contributing to a portion of the overdose deaths to which our detectives respond every day in all corners of the state. The samples being tested by our state police lab underscore the growing prevalence of fentanyl. In 2013, just 5 cases submitted to our lab involved seized drugs that tested positive for fentanyl or a mixture of fentanyl and heroin. In 2014, our lab handled 170 cases with drugs that were positive for fentanyl, either by itself or mixed with heroin. So far this year, the number has grown to 473 fentanyl-involved cases to date. Because fentanyl is so powerful, as you have heard, more powerful than morphine, more powerful even than pure heroin, it poses a significant threat of fatality, whether used alone or in a mixture of another drug. The state police and our federal and local law enforcement partners remain committed to identifying and arresting the sources of illegal narcotics being sold in our cities and towns. Our enforcement operations range from street level buy bust, like the one in Framingham and Natick last week that resulted in 10 arrests, to larger sustained efforts, like the one that dismantled the Lawrence drug trafficking organization and seized multiple kilograms of heroin earlier this summer. Once we arrest traffickers, prosecutors need appropriate laws to hold them accountable to the criminal justice system. And I thank you.
Hello, I'm Chief Bill Brooks from the Norwood Police Department, representing the Massachusetts Police Association. I just want to echo what's already been said, that this is a big deal. This is an important bill. It's something that we drastically need. You know, understand that when police arrest a trafficker and charge him with heroin trafficking, and then that sample comes back from the laboratory testing positive not for heroin but for fentanyl. Although fentanyl is a more powerful drug, the charges actually need to be downgraded, because although fentanyl is a opioid, it's a synthetic, and the current trafficking statute only addresses heroin, morphine, and derivatives of opium. It does not address synthetics. So this is really an important move, that when we arrest a heroin trafficker, and as it turns out, he's actually selling heroin, that we don't have to downgrade those charges. I just want to echo what Chairman Fernandez has already said, and that is that a great deal of emphasis is being placed on the fact that addiction is a disease, and it absolutely is, but it is our only disease that's driven by drug trafficking organizations. And this is not the time for us to let up on the enforcement side of the important work that's being done around this horrific problem. Thank you very much.
Thank you very much to all of my colleagues in law enforcement. Thank you in particular to Kathy for her willingness to come forward and share her story. And at this time, we'd be happy to take any questions.